moving toward case studies, which you have unfolding cases. The point was to get fidelity in a way that as close as possible, and it could enhance over time, Donna, meaning that, look, we are not at virtual reality yet. That's a bridge too far at the moment. But the reality is trying to use word-based approach to get to fidelity as much as possible, so that we can actually measure a future nurse's ability to make critical decisions at the right time, for the right reasons, for public safety at the end of this, or our client safety at the end of this. So I think that that's number one. So case studies, big change to the NCLEX. The other one is the ability to have the standalone items, although I think that's a smaller impact. I think the case studies are the bigger impact. So, because those are just different item types, but they're single items. And ultimately, the other change, although again, I don't think it's big, is that the minimum length goes from 60 to 70, and the maximum goes from 130 to 135. Ultimately, if you look at this exam, Donna, I think that there's very little changes except the case studies. The amount of time, everything else is the same. I don't think the experience in terms of sitting down to take the test is going to be any surprise. Keep telling them what it looks like. We will be creating a look and feel exam before this launches, so candidates can go out and see it in a tutorial to take that fright away from them. But I'd focus on the big change, which is case studies and fidelity.